The COVID-19 pandemic has exposed how Africa lacks capabilities and capacity to manufacture its own pharmaceutical products, including vaccines. Leaders in the continent are now racing against time to ensure the continent manufactures its own pharmaceuticals. South African President Cyril Ramaphosa recently said his country will be hosting a technology transfer hub for coronavirus vaccines in the first step towards Africa producing its own vaccines in the future. He said this move is critical for Africa's self-determination.
The ability to manufacture vaccines, medicines, and other health-related commodities will help put Africa on a path to self-determination. This will enhance our capacity to take responsibility for the health of our people.
Hello and a warm welcome to another edition of Africa Today, a program which gives you an incisive analysis on events making headlines in Africa. This week, we are focusing on Africa's efforts to attain self-sufficiency in the production of pharmaceuticals amid severe shortages of medicine and vaccines during the current COVID-19 pandemic. Like any crisis, the COVID-19 pandemic could represent an opportunity to lay the groundwork for a better future. Will African countries rise to the occasion? Join us till the end of our show as we analyze Africa's quest to manufacture its own pharmaceutical products.
Africa's own pharmaceuticals. The COVID-19 pandemic has exposed gaps in health services that require urgent attention in many African countries. In most of the sub-Saharan Africa, pharmaceutical imports comprise as much as 70 to 90% of pharmaceuticals and medical consumables, and that is not sustainable. The few African countries with relatively developed pharmaceutical industries include South Africa, Kenya, Morocco, and Egypt. During the current pandemic, many rich countries have been stockpiling vaccines and other medical supplies for their citizens. These rich countries are way ahead in vaccinating the vast majority of their population, while even the most vulnerable in poor countries haven't gotten a single shot. This is a clear case of vaccine nationalism and apartheid. The World Health Organization Director General once again recently condemned vaccine nationalism.
Vaccine nationalism, where a handful of nations have taken the lion's share, is morally indefensible and an ineffective public health strategy against a respiratory virus that's mutating quickly and becoming increasingly effective at moving from human to human. Variants are currently winning the race against vaccines because of inequitable vaccine production and distribution, which also threatens the global economic recovery.
The dependence on imports has left most Africans vulnerable to shortages of medication and vaccines, a problem that has triggered a continent-wide crisis during the pandemic. Stakeholders in Africa are now taking action to tackle this problem. Akinwumi Adesina, the president of the African Development Bank Group, recently addressed a meeting dubbed Building Africa's Healthcare Defense System, where self-reliance in pharmaceuticals was one of the issues in focus. Let's take a listen.
The lives of 1.2 billion people in Africa are at risk. Africa, therefore, urgently needs a healthcare defense system. Building Africa's healthcare defense system can be achieved by giving priority to three critical areas. First, local production of vaccines on the continent. Second, developing Africa's pharmaceutical manufacturing capacity. Third, building quality healthcare infrastructure.
For more on Africa's pursuit for a homegrown pharmaceutical industry, we have contacted Linda Msarira, the president of Zimbabwe's Labour Economists and African Democrats, a Pan-African political party. Thank you for joining us. We also have Julius Mbaluto, a journalist and African affairs analyst. Thank you too for your time, Mr. Mbaluto. Now, let's start off with Msarira. How has the reliance on imported pharmaceuticals affected African countries during this COVID-19 pandemic?
We need to realize that over-relying on imported stuff will affect Africa. It will affect us tremendously because we're now getting at this time where every country in the world wants to get vaccination for their people. And as long as Africa is not organized and still waiting to be receiving donated vaccinations, Africa is going to be in trouble. And we're going to lose a lot of people in Africa because of our lack of planning and programming and waiting for donations. I actually implore most African countries and African leaders to ensure that they have their own vaccination budgets in place to ensure that they'll be able to deliver the vaccination to their people timeously.
Speaking during the Building Africa's Healthcare Defense System, the World Health Organization's Regional Director for Africa said COVID-19 has been a reality check for Africa, which hinged its hope largely on global solidarity. She also briefly highlighted on the state of the pharmaceutical industry in Africa.
First of all, it's a very painful realization that Africa is a prime market for fake medicines with serious and often disastrous impacts of health. And then also to note that 99% of the vaccines and 70% of pharmaceuticals are imported to African countries. During the pandemic, we've pinned our hopes on global solidarity and are right now being hit with a huge reality check brought home dramatically in the example of access to COVID-19 vaccines. And this has highlighted the need for self-reliance.
Now, Mr. Mbaluto, how has the delay in delivery of much-needed medicine and vaccines impacted on the lives of people in Africa?
What that delay has done was it just meant that a lot of people in Africa have lost their lives, have lost their loved ones. And even as we speak, some are still going through those challenges. So that reliance has not been great. And also, the idea that Africa wasn't able to produce their own medication also, it means also there's a big problem in terms of the global order. The problem is all these countries are interconnected. We are living in global villages, they call it. One thing happening in one country will always have a way of affecting others. So ignoring Africa or thinking about Africa as a last resort.
Mr. Mbaluto, you have said there that reliance on others for vaccines is a wake-up call. Now, can we say that the COVID-19 pandemic is a cloud with a silver lining that will eventually enable African countries to be self-reliant in the pharmaceutical industry?
There are so many lessons that COVID-19 has forced Africans to learn. And lesson number one, we have to have solutions to problems locally. We have to look for solutions also in Africa itself. When it comes to pandemics, we have to have that capacity to produce medicine to be consumed within the African continent. We have to also be able to appreciate the expertise of doctors in Africa and scientists. These are lessons that COVID has really forced African countries to learn. And also, the thinking in the future should be like, yeah, Africa has to produce its own medication. Africa has to rely on itself.
Now, this disparity in the supply of COVID-19 vaccines is causing anger among many African politicians. Ugandan President Yoweri Museveni says the current situation is also a wake-up call.
This unfortunate phenomenon where people have vaccines and they say, no, we must first vaccinate our own people. That's unfortunate, but I like it because it works you Africans. Africans are a disgrace to ourselves. Why do you have to depend on the outside for everything? Life, you depend on the outside. Why?
Now, Ms. Msarira, what's your take on efforts by African countries to manufacture their own pharmaceutical products, especially the COVID-19 vaccine, in the face of the vaccine apartheid and nationalism perpetrated by Western countries?
as long as African leaders are not promoting traditional leaders in their own countries and those who've got Western medicine qualifications to come up with vaccination programs and vaccinations for African people, I don't see any effort that will be fruitful in Africa to produce our own vaccinations. We should understand the fact that most African leaders, most African people are still drunk with the colonial systems that were left in place by the colonial masters. They believe that everything foreign is the best, they shun their own systems, and everything that is African is deemed to be evil. The Western people stole Africa's self-determination. They stole everything that is African. And it is important for us, Africans, especially us, the younger generation, to start saying, how did the older generation do it? How did African people deal with such pandemics?
Thank you, Ms. Msarira. We shall now take a short break. We have much more in store for you as we analyze African efforts towards attaining self-sufficiency in the production of pharmaceutical products. Stay with us.
Africa's own pharmaceuticals.
Building more pharmaceutical manufacturing capacity in Africa will require long-term investments, but countries could offer incentives, such as cutting tariffs on raw materials. Ugandan President Yoweri Museveni says what Africa needs is raw materials to produce its own COVID vaccines and not donations from the developed nations.
The raw materials for this vaccine, because of the economies of scale, sometimes it is not economic to produce every raw material, every input. It is sometimes cheaper and quicker to get some of the inputs from outside. So give us those inputs. But my people have been getting problems. It seems some people don't want Africa to stand up.
Now, Mr. Mbaluto, what are some of the stumbling blocks towards attaining self-sufficiency in Africa's pharmaceutical sector?
The willingness is there. The expertise is there. Most of these scientists and doctors who are key in the dealing with COVID-19 pandemic, most of them are from Africa as well. So the knowledge is there, the expertise is there, but the problem is the international order, because World Health Organization controls all these flows and all. And as we are speaking right now, we saw the right to produce these particular COVID-19 pandemic jabs being given to a few companies, and also those were given the patent, which means even if in Africa they wanted to produce that, they cannot go ahead because of that world order. This world order has to change.
Mr. Mbaluto talked about the need to waive patent rights on COVID vaccines to boost global production. WTO Director General Ms. Ngozi Okonjo-Iweala has joined African countries and other developing countries in calling on global pharmaceutical giants to waive patent rights for vaccines.
We need to listen to what the developing countries who are asking for a waiver are saying. We need to dialogue with them and find ways of accommodating their concerns on intellectual property, whilst also making sure we do not disincentivize research and production.
In June last year, the AU launched the African Medical Supplies Platform, which promotes the procurement of medical supplies from local manufacturers. This is expected to encourage local manufacturers and reduce reliance on imports. Addressing a virtual session during the launch, President Paul Kagame of Rwanda said it was time for African countries to stop being sorry for themselves and act.
Therefore, for Africa, move from being really very sorry for ourselves, which is the case today, and I think no one, maybe single person, takes the blame for that, but we have to overcome that and move from what we know has not worked for us, for Africa well, to something we can do and we are able to do, given a few examples, again, President Ramaphosa mentioned.
Nearly 6 decades after independence, most African leaders are still talking about having their own pharmaceutical, but their countries still lag behind. Where is the problem here?
The tragedy of Africa is corruption. And African governments have deliberately thwarted any effort in their own countries to ensure that we have local pharmaceutical companies that thrive.
Boosting local pharmaceutical production is expected to save lives, improve public health, and strengthen African economies, including supporting local jobs. It should also trigger the sharing of crucial technologies. How will self-reliance in pharmaceutical industry contribute to the improvement of public health in African countries?
If we can see Africa even to the level that they are producing medication, which is acceptable globally, that number one is going to improve the economies of Africa. When Africa will be in control in providing medication for its own population, which is more than 1.3 billion, that would be fantastic. And the idea that these pharmaceuticals are on ground in Africa, production is happening, it definitely means the cost of medication will be comparatively cheaper than if it was all being sourced from the Western capitals. So it's a very important goal for all leaders in Africa. As they come to lead their nation, as anyone aspires to be a leader, think health, think of a healthy nation first. And just ask yourself, what can that do to the economy of the country, to the wellness of the nation?
Africa has so many thousands and thousands of its medical personnel outside of Africa. Just because the infrastructure is so poor, they don't want to work here. So we need to connect them back and have financing facilities that allows us to tap our best minds in diaspora and bring them back into Africa.
Many African professionals have been forced to look for greener pastures in Western countries due to low salaries at home. Now, governments have invested heavily in training these professionals who have now been poached by developed countries. A Nigerian doctor explains here why doctors are leaving the country.
Working conditions for health care professionals in this country are quite deplorable. The pay, equipment and facilities to manage, to diagnose patients and manage them effectively are generally lacking in most health institutions across the country. This in itself is enough for one, after a lot of years of rigorous training, to seek greener pastures elsewhere. It's not just seeking greener pastures, but the job satisfaction.
Now, Ms. Msarira, what should governments do to prevent this brain drain, which has affected the health sector in many African countries?
The biggest challenge that we have in most African countries is we've got leaders who are out of touch with realities of the real struggles that African people go through. It all goes back to the misgovernance systems that we have, the colonial systems that were adopted from the colonial era, where we have had no serious efforts to ensure that we change the systems that were left in place during the colonial systems to have systems that work, that serve the African person. It is unfortunate that most doctors or pharmacists prefer to go and work in Western countries to get better salaries. But at the end of the day, they will still have to plow back home and send a lot of money back home for their own relatives to be able to get proper health care. What we need to do as African people is to ensure that we push our governments to comply with the Abuja Declaration. We make sure that all health personnel, frontline workers in the health industry, have got decent salaries that can sustain their livelihoods and their families.
Ms. Msarira there talked about the Abuja Declaration on Health. Now, in 2001, African governments made an historic pledge to allocate at least 15% of their annual budgets to the health sector. This vow became known as the Abuja Declaration.
WHO Regional Director for Africa, says countries in the continent have failed to fulfill this pledge, but has expressed optimism that the situation will change. The head of the Africa Center for Disease Control and Prevention, John Nkengasong, says Africa's ability to respond to future pandemics is dependent on how much investments governments on the continent make in health and education. Nkengasong says Africa needs to develop its workforce, improve manufacturing capacity of diagnostics, and building capacity in vaccines development and treatment.
You go to war against these viruses with 3 dimensions. You have to have your diagnostics, vaccines, and treatment all together. So that has to be an African-driven solution and approach for that. The third area, of course, is institutions. You fight wars with institutions and strong public health institutions for the continent. Clearly, no doubt about that. And then thirdly, partnership with the private sector.
Mr. Mbaluto, our last question to you. What needs to be done for the pharmaceutical industry in Africa to meet the needs of the masses?
The regulation of the production of medicine has to really be reformed. It has to see professionals for who they are. It has to know, it has to recognize that even in Africa, we have professionals who are as good as any other professionals. So the international regulatory mechanism for production of medication has been the challenge, because to pass any medication that has been produced, it goes a long way, it takes a long time, and also it's a cash-intensive program also, because it requires a lot of money to do this, and therefore there should be reforms from the international system that are all the time hindering Africa from producing its own medication.
Mr. Mbaluto there says that the international regulatory framework is inherently biased against African innovations. Thanks a lot for your time, Mr. Mbaluto, African Affairs Analyst. Now to Ms. Msarira, you have the last word. What will it take to have a vibrant pharmaceutical industry in Africa?
The biggest impediment in attaining self-reliance in pharmaceutical companies in Africa are inconsistent pharmaceutical policies, inconsistent health policies, which do not benefit the ordinary people in Africa. So what is important is for African people to start making sure that they hold their governments to account. They push for local pharmaceutical companies which can provide and deliver affordable, safe medicines to the people in Africa. It is also important for African countries to start investing in grassroots acquirement of medicines, because most of these medicines that we import, most of the raw materials actually come from Africa, but they go and get processed in other countries. But when our government, our university starts ensuring that they put more resources into pharmaceutical companies, into production of medicine here in Africa, it will be a good idea which will be able to lift Africa out of the poverty and the health crisis that we have in most African countries.
Well, very well put there. African governments need to commit more resources for the pharmaceutical industry in the continent to compete globally. Thanks for your insight, Ms. Msarira, the President of Labour Economists and African Democrats. Our time is over for today. I'm sure you enjoyed the show. So don't forget to send us your comments through our social media handle appearing on the screen. You can also watch this program by visiting our website, presstv.ir. Thanks a lot for watching. Take care and goodbye for now.